So 3.3, we're going to be looking at experiments and observational studies and the difference between the two types of studies. Okay? So first we're going to look at observational study. There's no treatment assigned. And there can be a treatment, but it's not assigned. It's not random assignment. It's just going to be whatever's happening naturally to each observational unit. It's passive data collecting. Okay? Two types of observations. We have retrospective and prospective. Okay? Retrospective, you identify the variable, then find observational units that match that variable. This is collecting data that has already happened. A lot of times this is going to be looking at medical records. Okay? If we're going to look at treatment of how people were treated for, say, let's say cancer, well, we're not going to randomly assign them treatments. Okay? Doctors are going to assign the treatment that best fits that observational unit, that patient. So we're not going to go, okay, here's our observational unit has cancer. Let's see how were they treated, what was the outcome. Okay? So we're looking at the observational unit and what has happened to them beforehand in the past and collecting data that way. Prospective, you identify the observational unit in advance and observe that and see how things unfold. Okay? So this can be randomly selected observational units. We have our pool of observational units and we may randomly select observation units from that pool. Now this might say, okay, I want to observe note-taking, okay? Some note-taking habits of students. So I may then randomly pick students and follow them and see, okay, this is what they're doing throughout the day. This is the class they take the most notes in, the least notes in, things like that. But I'm selecting observation unit and then following and observing them moving forward. Okay, so it's kind of moving. Retrospective is looking at old records. Prospective is moving forward as we look at those. Right. No matter if it's retrospective and prospective, we talked about this many times. You cannot have a cause and effect conclusion with an observational unit. With an observational study. There are too many outside variables that are not being controlled, and that's the main thing with observational unit, probably the main difference between experiments and observations. Observations, you're not controlling outside factors. Now for experiments, okay, must have at least one explanatory variable and a response variable. Okay, you need to identify your observational unit as you're looking. Okay, then here's some other terms that they might be referred to by as you're moving forward. Okay? Now what we do with the experiment, so I said the difference between experiment and observation is controlling outside factors. With experiments, we're going to do things to control outside factors so we can look at that explanatory variable. Okay? Now it says you have to have at least one, there may be a couple of them, but we're going to see, and we're not trying to narrow it down, so just that observation or that explanatory variable is being studied and we're able to narrow down, okay, this happened in the response and it's because of that explanatory variable. Okay? And one way to do that is with random assignment. Okay? An experiment must have that random assignment, the random assignment into your different treatment groups. Okay? Treatment groups are randomly assigned from the sample, and when you have random sampling and random assignment, there is a difference between the two. Random sampling is when you are selecting your observation units from the population. Okay? The random assignment though, random assignment is when they're being placed into the treatment groups randomly. Okay? So please make sure you note there is a difference between random sampling and random assignment. Okay? When treatments have different degrees, those degrees are called the levels. Okay? So that's just saying, okay, we have a treatment group, we're going to be looking at a study that has maybe some medical clinical study has 3 different levels of medicine, saying 5 milligram, 50 milligram, 100 milligram, and seeing how that level or the amount of medicine is affecting each one of our patients. There's 156 adult males are taking part in a study of a weight loss supplement. The sample would be placed in 2 groups, one taking the supplement, one other taking a placebo. Both groups' daily routine will be as similar as possible throughout the study. What we're going to look at here is something called a web design. Okay, we're going to be looking at how in our study, how you're going to organize it. Now, some people say this looks kind of elementary. Some of my students are wondering why you have to do this. It is a way to organize your thoughts, and it's a way of seeing, okay, when is our random assignment happening? What are we comparing? How is our group getting split up? It's just a little diagram so you have it on paper so you can see what your process is going to be. It is important for an experiment that you are protecting your observational units. Being organized and knowing your procedure is very important. A web design is just another way to do that. Okay? So there's our situation, there's our study, and this would be our basic web design. We have our 156 males. The key part here, this is the random assignment part, and I have the term random, and that's showing that right here, those 78 males were randomly selected, those 78 males were randomly selected from our sample, okay? And then we have our treatment, the supplement, the placebo, and at the end, we're comparing and it's showing what the response is. We're comparing their weights. It's a weight loss program, so we're seeing, comparing their weights. This is considered a basic web design. Okay? We had our sample, our 2 treatment groups, and then we compare the weight at the end. Very important that you're showing you when the random assignment is happening. Now, to get a little more detail here, out of the 156 males, 106 of them were 18 to 29 year olds, and 50 of them were 30 to 50 year olds. So let's just think about this for a second. Our bodies are changing. As you get older, your metabolism slows down, losing weight's a little different. Can we say that 18 to 29 year olds lose weight or keep their weight the same as 30 to 50 year olds? I'm gonna say no, okay? Things are changing, so that's something that also could be an outside factor. Another way to control that outside factor is with a block design. Now what a block design is going to do, it's going to take those 18, 29 year olds, the 30, 50 year olds and split them up. A block design takes a characteristic of the observational unit. It's something that could also affect our response, and we're going to split that up in the very beginning. It's a way of controlling that factor now. So now when you're split, when we randomly select here, is it rare? Yes, but it could happen that most of the older males are in one group, younger males in the other. Well, that's going to affect our responses. It's not proportional anymore. It's very rare that it's going to happen, but it could happen. Doing a block design is going to control that. So here's what our block design would look like. We have our 156 males. The 106 younger males, 18 and 29, are in one group. 50, the older males, 30 to 50 year olds, are in the older group. So that's split up there. That's considered our block. Okay? So that's considered our block, and from there now we have our random assignment. And again, I'm marking down when the randomness is happening. Now I know the groups aren't going to be equal. We have 106 here, 53 and 53. Down here for the older group, we have 25 and 25. That's fine. We're comparing the older gentleman first, and then we're comparing the younger gentleman. That's fine that they're not equal. Okay? We have our random assignment here, so we do have the experiment, and now we compare weight and weight, older group, younger group, and then the overall together. So this is controlling a bunch of different things here. This randomness is controlling maybe how people's eating habits and exercise, that's controlling that factor, spreading that out. One factor that we thought of beforehand is splitting up the younger and older gentlemen. And this is something you may have multiple blocks. It's not just limited to one. You may have, okay, here is our younger gentleman, older gentleman. We're also going to split them up with regularly active people, non-active people. Okay, there are multiple blocks that you could do with our sample before you actually have the random assignment. These are variables that you're going to think about, that you're going to have to think about, and how will they affect your study. Okay, so make sure you know difference between a block design and a basic block design. And a block design is going to have a characteristic that is going to be maybe a confounding factor. So if I ask you to come up with a block, don't just randomly say, okay, let's do age, or randomly say gender, males and females. Okay, make sure that factor could affect the response that we're looking at. Okay. I thought that age is something that affects someone's weight, so yes, it is a factor that we wanted to control. Okay? The variable used to break up the sample is called a block or a blocking variable. Okay? In the last example, the blocking variable was age. Okay? So we split them up by age. Okay? For the control group. Okay? Control group is going to be a group that you use, keyword here, to compare. You're comparing the results. Okay? Many times the control group, it's not going to have an active treatment. It's our status quo group. We want that to be almost the baseline, so we can see, okay, what is happening with our explanatory, and is the response the same as our baseline group? Because if the explanatory is not really having an effect and both groups are the same, we can tell that because the baseline, who shouldn't have any change in the response, is going to be the same results as that group that did take something. So we know that explanatory is not really having an effect on our observational units. Okay? Sample of 50 adult males, all are taking a weight loss supplement, and their weight is recorded before and after the trial. Okay? Well, how do we know what's changing? This is what I mean about the baseline. If everyone's taking the supplement, well, if everyone loses weight, I mean, we're not saying that's going to be the supplement. We don't exactly know. We don't exactly know, did they actually lose weight? Okay? Maybe that might just be natural. Sometimes, depending on where you live, these seasons sometimes can affect your weight as well. You're more active in the summer, so you're burning more calories. People may lose more weight in the summer. So things like that are going to have to be controlled. So an experiment this way, it's not even considered an experiment because there's no random assignment in the treatment groups. We're just taking one group of individuals, giving them the supplement. Okay? Not exactly the best study organization here. Okay? 50 adult males, 25 individuals are taking a weight loss supplement. All 50 have their weights recorded before and after weights are compared. Okay, well here now we have two groups. Let's assume those groups were randomly selected. One group's on a take a weight loss supplement, the other one's not taking anything. Well, this is now where we're looking at making sure the procedure is the same for every observational unit. In an experiment, every observational unit needs to be treated the same. Okay? You don't want someone taking a pill and another group not taking it. In their mind, they're always thinking, okay, why should I be losing weight? If this group's taking the medication and I'm not, they should be losing weight and I'm not. The mind's a powerful thing, and there's other ways to control that, which we talk about in another section. But only having one of your groups taking something and not replicating it from observational unit to observational unit, that's going to be a poor example as well for a study. A sample of 50 adult males, 25 of the individuals took a weight loss supplement, the other 25 took a placebo pill. All 50 have their weight recorded before and after the trial. Now, placebo right there, that means that's a fake treatment. Everyone's taking the pill, so the procedure is exactly the same for every observation unit if they're in the placebo group or the supplement group. So now everyone's mind's thinking, okay, I am taking this medicine because no one really knows. Okay? So everyone's working the same way. Everyone's going through those same procedures. So now when we look at the results between our two groups, as long as they're randomly selected, now you can see, okay, if one's higher than the other, if one's lower, we can say, okay, that was because of our explanatory. Now we're getting more narrowed down and zoning in on what our explanatory is actually doing to the response. Okay, blinding. Now, this is kind of what the placebo is being used for. Okay, there's a single and double blind study. Okay, if either of the two categories of individuals does not know who is getting the treatment, it is considered a single blind experiment. Now, when it says two categories of individuals, there are two people we're not worried about for blinding. The observational unit, the people in the study, and we also worried about the researcher. Okay? The researcher is also important. We'll talk more about that with the double blind. Okay? But if one of those two groups do not know who's taking the placebo, or who's taking the treatment, who's taking placebo, it's considered a single blind study. So that example we just had, okay? One group's taking a supplement, the other group's taking placebo. As long as they don't know who's taking what, that's considered a blind experiment, a single blind experiment. And it's to keep the procedure the same for every observation unit, and you don't want there to be any mind games being played. Who's taking the supplement, who's not taking the supplement. Everyone thinks they're taking the supplement, so everyone's moving forward the same. Okay? If both categories of individuals does not know who's getting the treatment, it is considered a double blind. And this is important if the researcher could have any influence on the response. Okay? If the researcher is going to be recording things and they could consciously or subconsciously, okay, skip there, consciously or subconsciously have an effect on the response, you want this to be a double-blind study. Okay? So let's say if the researcher is looking at someone supplement for pain relief. Okay, well, one way the researcher might be marking out how effective it is by recording the movement of the observational unit. Okay, and it might be, okay, I'm going to observe how well is he bending over, how well are they twisting and turning, do it look like that they're achy? Well, that's kind of my opinion. Okay, that's my opinion, saying, okay, the person is moving more smooth, the person's not wincing when they have to bend over. What's actually considered a wince? What's actually considered a smooth movement? That's my opinion. I would have an effect and an influence on how the response is being recorded. I'd want that to be a double blind, since I would have some kind of insight on how the response is being recorded. Now, the weight loss supplement, these observation units are stepping on a scale and it's telling them their weight. So this really is not anything that I would have influence on. So it really wouldn't need to be a double-blind study, since the scale is doing all the recording. It doesn't really matter my thoughts on it at all. I have no way of influencing it. Double-blind really wouldn't matter, and that's how you would have to decide. Does the influencer, is their opinion doing anything that has to, does it have anything that could affect the response that is being recorded? Okay? If there is a way it could affect, you want it to be a double-blind study. Okay? If it's just a measurement, say it's a scale or just some kind of measurement with a ruler, distance, something like that, then it might not matter. Observation versus experiment. Observation. Okay? It is useful to finding trends. Okay? Looking at it and seeing, the example I used earlier was students taking notes. I can see, okay, history classes, that's the most note-taking being done. The math classes are second. That's a trend that we could see with an observation. Okay? The cons are you're not controlling those lurking confounding variables. Okay? And because you're not controlling those variables, you can't have that cause and effect relationship. Okay? So yes, you can see this is the most, this is the least, but you can't say this is causing that to be the most. Okay? You can't, because there's other factors that could be at play in that situation. For an experiment, okay, we are controlling the outside variables, so that's the pro here. So that means we can narrow down on just that one explanatory factor. The specific factor is what we're focusing on, since we're controlling those outside factors. Okay? The evidence can have a cause and effect, especially if it's done correctly, and you do have it now down to that one explanatory factor. The cons, they are hard to do. Doing that controlling that, having the procedure be the same for every observational unit, that is difficult. Okay? It takes a lot of time, it takes a lot of money, and that's why a lot of times experiments can't be done, because of just, it's not reasonable or plausible to actually conduct the experiment or the study in that manner. Okay? So this is a good intro to difference between observation and experiments. Make sure you take a look at the web designs. Make sure you know the terms block design, blinding, and know what they mean. And the main thing is the difference between observation and experiment. An experiment has the random assignment. If you have random assignment, you can then start saying we're controlling factors, and we can have a little bit more cause and effect conclusion.